At this time last year, the novel coronavirus COVID-19 was merely a blip on the radar, noticed and being watched, but as something happening elsewhere. Fast forward a year, and we are nearing 500,000 deaths in the United States alone, attributable to this pandemic, and tens of millions infected, many with lingering health issues. Dr. Mathew Logan, Chief Medical Officer and VP of Medical Affairs of Self Regional Healthcare, is on a mission to inform the members of Greenwood County about the current state of COVID vaccination. Thank you, Dr. Logan, for joining us this morning and working tirelessly as a member of the medical community to help us through this crisis, even when there's so many unwilling to accept its seriousness. So what I'd like to do is turn it over to you. You have a small presentation you would like to give our members today.
Yes, and thank you for having me today. We'll start with kind of an overview of where infections have been from the start. Back, about March or so was when we first started seeing infections show up in our community. And this slide basically is from DHEC, and it shows the number of infections by day that were identified through testing since the beginning of the pandemic through just a couple days ago. The green line is a 7-day moving average of the number of infections, and you can see we had a peak around August, and then there was a little bit of a lull, and then after the Thanksgiving, Christmas holiday season, we just had an influx of COVID positive infections in the community. Fortunately, we've seen it come back a little bit, and I'll talk about that in just a minute. Currently, as of this morning, this is February the 5th, as we're discussing this, we have had, today we have 42 COVID positive patients currently admitted to the hospital. 9 of those are in the intensive care unit and 6 are on the ventilator. To date, since the start of the pandemic, we've had 162 COVID-related deaths at our hospital and 984 COVID admissions. Self Regional is doing a pretty good job managing this population. Overall, we've had a 16.5% death rate. Basically, what that means is that if you're sick enough to have to be admitted to the hospital, about 16.5% of the people that get admitted with COVID diagnosis end up succumbing to it. The state average is 18.7%. That data is from South Carolina Hospital Association. So relative to other hospitals in the state, we're providing as good or better care here at Self Regional as any of the other hospitals. Our ICUs have been full recently. Fortunately, again, we've seen those numbers come down some in the last week or two. But about 3 weeks ago, every one of our ICU beds was full, with about half of those ICU beds with COVID positive patients. This next slide that I'm showing you here, basically on the top, this top graph shows the number of admissions by month since March. So you can see in March we had just 3 COVID admissions. So 3 of the patients that got admitted that month had tested positive for COVID. We had that peak in August, and then fortunately things kind of came back down. In the middle of August, we thought we were just overrun. It was like, goodness, we just could barely keep our heads above water. And then we were so glad to see that lull. And then what happened in November and December, it just is part of living. Folks want to get with their family, and I understand that. As you can see, in the month of January, we had 235 admissions to the hospital with COVID. And January also was our highest month for COVID-related deaths, where we peaked at 50 deaths during the month of January. I just say that just to point out that it's not over. It's not fake. Our nursing staff, our physicians here, our the medical assistants, to the EVS workers, everyone who's here is working really hard to help care for these patients. And it's tiring. The medical staff here is tired. We're trying to do the best we can and kind of keep our heads above water, but it is wearing on the staff from an emotional standpoint as well. To have that many people die during a single month or two is very emotionally draining, particularly when you're given 100% to try to help these folks. So again, I just really wanted to say this piece of it, just to say COVID is real. It's not fake. There's a lot of misinformation on social media that I see on Facebook. It just kind of makes me sick when I know people read that and will believe those things that may be floating around, that it's some type of a conspiracy that's not real. But I assure you, it is real, and we've seen a lot of it here, and a lot of people in our community have been affected. So what can we do to try to help get on the other side of COVID? Right now, we're still in that phase of prevention. So we still need to wear a mask when we're in a public setting, or when we're around others around outside of our home, wash our hands frequently, and keep a safe distance, at least 6 feet from others not living in our home as much as possible, and try to avoid large gatherings, particularly indoors. And then the other big thing is vaccines, and vaccines are here. We received or started giving COVID vaccines on December 14th. It was our first day, and we started with our medical staff. We are following the DHEC guidelines. DHEC is very strict with who can get vaccine and when. And I'll give you our numbers. As of yesterday, we have vaccinated 16,171 injections, and of those, 12,891 individuals. It's a 2-dose vaccine. You give 1 dose, and then of the Pfizer vaccine is what we're giving here. They give the first dose, and then 3 weeks later, plus or minus a little time, there's some leeway on the second dose. You give that second one. So
Dr. Logan, I will share that I've received some feedback from some of our elderly members who have gotten vaccinations, and it has been nothing but praise. 2 things. One, nobody's experienced any significant side effects. Just a little soreness is what has been reported so far. But probably the most important thing is that just the logistics has been so smooth. They were waiting, they were expecting long wait times, big lines outside. They saw none of that. They thought the whole organization was smooth, and hats off to you and your entire staff for putting together a very easy mechanism for them to receive that vaccine.
Thank you. I want to show you this next slide. I know there's some hesitancy from some about the vaccine, or does the vaccine even work? I just try to make this simple. This is again, this is directly from the Pfizer study. The writing on there is not from the Pfizer study, but the graph is. The blue line at the bottom of this graph basically shows. You can see basically the bottom line shows the vaccine. So those that got vaccinated, this is the incidence of COVID infection in the placebo group in the red dots, and then in the blue dots is those that got vaccinated. And you can see a really sharp disparity there around day 12, where the incidence of COVID infection is dramatic. It's a dramatic difference from folks that got the placebo to the real Pfizer shot. There are some pharmacies here in town that are starting to administer vaccines. I know that Publix has started. I understand that CVS is starting. I'm not sure if it's this week or next week. And also, this is the vaccine when DHEC does an event like in our community to provide vaccine in the community. They use the Moderna vaccine as well.
So if I may ask at that point, so we're seeing a broader distribution of providers giving the vaccine. Do individuals call Publix directly to schedule an appointment? Do they call, Walgreens? What's the best way for them to get into the queue if they qualify?
Sure. I've been looking at that a little bit. It looks like the majority of those are online registration forms. For specifically, I know Publix is an online registration form. DHEC, I believe they have a call number as well as some online options to register for those events.
Okay.
So anyway, there are other options besides self-regional. Certainly, we I think have given more than any other entity in our community, but we certainly are glad to partner and give as many as we can. Just again, a common question about side effects that you mentioned that a minute ago, just to talk about that. It's similar to other vaccines. The most common side effect is muscle soreness at the injection site. Others include feeling tired, headache, joint aches, possibly some fever. Most symptoms go away within 24 to 48 hours, and it's more common after the second dose of vaccine. I know when I had my vaccine as a healthcare provider, I've just had a sore shoulder for a couple of days. That was basically it, and that got better, and it was the same thing on the second. And so when I say that, the numbers are like 5 out of 1 million people who get injected will have anaphylactic type reaction. So it's not like large numbers of people are developing anaphylaxis or having these severe allergic type reactions. Where the flu vaccine is somewhere around 2 out of 1 million will have that type of reaction. So it's thought to be extremely safe. So far, so good. Out of the 16 plus thousand we've given, we have not had any reactions like that here yet. So we'll hope that doesn't happen, but if it does,
yeah, I'll take those odds for sure.
Yeah, for sure. Just a couple more things about the kind of the rollout of the vaccine. Again, just kind of who's eligible for vaccine right now. All healthcare personnel, anyone who currently lives in a long-term care facility. And then in South Carolina, starting next Monday, anyone who is 65 years and older has been moved into Phase 1A, which is where we are right now. So we're at South Regional. We're starting on Monday to vaccinate the 65-year and older crowd. So we're excited to move into the next phase. We're gearing up right now to get ready for next week, and we're planning on being able to do up to 1,000 vaccines a day through the hospital next week, and hopefully we can offer it to anyone who qualifies very quickly.
How about for those of us who sometimes feel like they're 65 years old when they wake up in the morning? Any hope for us?
Yeah, you don't quite qualify yet, but we'll get to that in a second. So Phase 1B will be next, and of course that includes currently the school systems, anyone's considered essential frontline workers, some first responders that may not have qualified yet, corrections officers, food and agricultural workers, U.S. postal workers, manufacturing workers, grocery store workers, etc. That's Phase 1B.
Is there any rough feeling as to when Phase 1B may be open, or is it really taking it week by week until those in charge feel it's appropriate?
Yeah, that's a good question. And our experience so far is it's kind of a weekly thing. The governor, I think they look at kind of how many vaccines they've given out and also the demographics of that population, that age range, and then they open it up kind of in a phased approach. But it's really a week by week thing. I would estimate this current phase will probably last 2 or 3 weeks, maybe a little bit longer. Again, we're real excited at the hospital to be able to get to the 1B phase. It's possible the governor's been known to do this before. There might be someone who's not traditionally in 1A, and rather than opening 1B, he'll just move someone else into 1A. I heard this week on a conference call that the school systems may get moved into 1A sooner than later. Then the next phase is 1C, which is basically 16 to 64-year-olds that have high-risk conditions. And then after that, Phase 2, which is anyone 16 and older. Currently, the vaccine is not approved. The Pfizer vaccine is not approved for anyone less than 16 years old. They just didn't study that population in the trials, and it's only approved for 16 and older. So that's kind of pretty much what I wanted to share with you. I would also like to mention as far as registering to take the vaccine at South Regional, just to make sure that everybody knows how to do that. There's 2 ways. The easiest way is just to log onto our web form. And if you go to the South Regional website, which is just www.southregional.org, at the top of that page, there's a link that says COVID vaccine page or COVID vaccine information. If you click that, on that very next page, there's a link to our COVID vaccine registration form. You can just fill that out, and one of our associates will give you a call back. Typically, we're getting the most within 24 to 48 hours to give a call back. And we also have a telephone option as well. And that number is 725-3555. And we're answering that phone Monday through Friday from 9 to 5. And again, it's open to 65 and older to go ahead and call now. The 65-year-old crowd will start scheduling next week to try to start getting them in. So and we'll work through that until we get as many vaccinated with that group as we can. And
Now, I call upon our membership, to check on your family members, your neighbors, your friends. Not everybody is internet savvy. Some have gone their entire lives without filling in a single form online. So keep them in mind, offer your assistance, check in on them, ask if they've been vaccinated, encourage them to get it if they haven't, and then guide them through the process, help them fill out the form or give them the phone number to call. But it's incumbent upon us as citizens and neighbors to help others out who may not be as connected as we are.
Absolutely. Yeah. Thank you for that.
Dr. Logan, you've answered most of the questions that I had received in advance. I think there's only two that I would like to ask here.
Sure.
All right. So one came from somebody who has a complicating health issue like asthma. What phase do those people fall in, and what's the feeling about receiving a vaccine if you have such a condition?
Sure. So people with asthma, if they're between 65 and 64-year-olds, they would qualify in 1C, which is still a little ways out. Now, we definitely recommend they get vaccinated. Folks with any type of chronic underlying lung disease are at higher risk of developing, more of a severe course with COVID if they were to get it.
The second question I thought was interesting. It was asking specifically about self's capabilities, but I guess this could extend to any other testers for being able to identify any of the COVID variants that have been making the news lately, such as the UK or South African strains. Do we have that capability within the county to detect that, should that be seen?
Sure, that's a good question. And what happens is we send some of our testing goes to state DHEC, and DHEC does some surveillance screening on the tests that they receive from around the state. Every single test that we do is not tested for a variant per se, but there are some sampling done at the state level where they'll sample a % of the tests that come there. And we do send, on certain days of the week, we send all of our tests to DHEC. Other days we run them in-house, but there is kind of there's a surveillance going on, but it's not every single test screening.
And the final question, is there anything that we can do to assist the morale of you and the team itself? If pizzas were to find their way to the front desk, would they be turned away? Or is there anything more substantial we can do to help our brothers and sisters working in the hospital get us through over the goal line here?
Well, I appreciate you asking that. And that means a lot that you guys would think about the staff here. We're actually working right now with our foundation, the Self Family Foundation,
yes,
and to set up a fund if folks wanted to donate to specifically the healthcare heroes at the hospital, and that will, I think, go live probably next week or so.
Okay.
Where folks can do that.
Well, we have a direct line to Mamie Nicholson, so she will make sure we're at the front of the line to contribute to that when it does get opened.
Oh, yeah. And if someone wanted to donate pizzas, it would be welcome, and it will be brought to the staff. So
okay.
That would be fun.
Fantastic. Well, Dr. Logan, thank you so much for your time. This was extremely informative, and greatly appreciate you reaching out to us.
Absolutely. And thank you for having me on today. And just spread the word. The vaccine is safe. It is effective. The hospital here, we really feel it's our mission to help protect the community, to keep from getting sick in the first place. But if you do get sick, we're here for you, and we'll do what we can to try to get you back on track.
Great. Thank you. Have a great rest of the morning.
Thank you. You too.